Hello and welcome. Today, we're diving into a common yet serious condition, acute pancreatitis. We'll explore what it is, what causes it, how it affects your body, and what can be done about it. Understanding this disease is crucial for timely diagnosis and effective management. So, what exactly triggers this painful condition? The top culprits are gallstones and heavy alcohol consumption. Gallstones can block the common bile duct, backing up pancreatic enzymes. Alcohol, on the other hand, directly injures the pancreas. Less common causes include high triglyceride levels, certain medications, abdominal trauma, infections like mumps, autoimmune diseases, and in some cases, the cause remains a mystery, referred to as idiopathic pancreatitis. Now, let's delve into the how, the pathophysiology. Normally, the pancreas produces digestive enzymes that are inactive until they reach the small intestine. In acute pancreatitis, these enzymes activate prematurely within the pancreas itself. This starts a process of self-digestion, causing inflammation and damage to the pancreatic tissue. The inflammatory response can then spread beyond the pancreas, potentially affecting other organs and leading to systemic complications. Acute pancreatitis is a relatively common condition. Its incidence varies based on geographical location and population. In the United States, it's estimated that around 40 to 80 people per 100,000 are affected each year. It's more prevalent in men, particularly those with a history of heavy alcohol use. The incidence is also increasing, possibly due to improved diagnostic methods and increasing rates of gallstones and alcohol abuse. The hallmark symptom of acute pancreatitis is severe abdominal pain. This pain typically starts in the upper abdomen and may radiate to the back. It's often described as a constant, dull ache that worsens after eating. Other common symptoms include nausea, vomiting, fever, rapid pulse, and a tender abdomen. In severe cases, individuals may experience dehydration, low blood pressure, and even respiratory distress. Diagnosing acute pancreatitis involves a combination of clinical evaluation, blood tests, and imaging. Blood tests are essential to measure levels of pancreatic enzymes, specifically amylase and lipase, which are significantly elevated in this condition. Imaging techniques, such as CT scans or MRI, help visualize the pancreas, confirm the diagnosis, and rule out other potential causes of abdominal pain. Ultrasound can also be useful to identify gallstones. While we don't typically categorize acute pancreatitis into specific types, it is classified by severity. Mild acute pancreatitis involves minimal organ dysfunction and resolves without complications. Moderately severe acute pancreatitis presents with transient organ failure or local complications. Severe acute pancreatitis is characterized by persistent organ failure, such as respiratory failure or kidney failure, and is associated with a higher risk of mortality. Treatment for acute pancreatitis focuses on supporting the body's natural healing process. This typically involves hospitalization. Initially, patients are kept NPO, meaning nothing by mouth, to rest the pancreas. Intravenous fluids are administered to prevent dehydration. Pain management is crucial and often requires strong analgesics. In some cases, a nasogastric tube may be inserted to remove fluid and air from the stomach. If gallstones are the cause, they may need to be removed surgically or endoscopically after the acute inflammation subsides. In severe cases, intensive care and supportive measures, such as mechanical ventilation or dialysis, may be required. Preventing acute pancreatitis largely depends on addressing the most common risk factors. For those with gallstones, elective gallbladder removal may be recommended. Reducing alcohol consumption is crucial for preventing alcohol-induced pancreatitis. Maintaining a healthy weight, managing triglyceride levels, and avoiding medications known to trigger pancreatitis can also play a role in prevention. The prognosis for acute pancreatitis varies depending on the severity of the condition. Most cases of mild acute pancreatitis resolve completely within a week with supportive care. However, severe acute pancreatitis can lead to significant complications, including pancreatic necrosis, tissue death, infection, pseudocyst formation, and even multi-organ failure, which can increase mortality. Recent research focuses on improving early identification of severe cases and developing targeted therapies to reduce inflammation and prevent complications. There's also ongoing research investigating the role of genetics and novel biomarkers in predicting the course of the disease.